time, if you're not careful, is the very bottom. We just did this the other day in regular class. It says maternity quickies. Are you with your girl?
Yes.
And pre-eclampsia triad, I want you to know, every time you see me write the word triad, what can you anticipate me writing on the board? A triangle, right? Triad means triangle. And so if you think about the triad and you look at my triangle, a pre-eclampsia triad has what? What does it say? Swollen
Hands or face.
hands and face. Now listen to me very closely. Unless there is swollen hands and face, be careful because swollen ankles don't count. Yes, in the preeclampsia patient, they will be swollen. But in a patient that only has swollen feet or ankles, that does not make them preeclamptic, not at all. So let's say it like this. All preeclampsia will have swollen feet and ankles. All swollen feet and ankles is not preeclampsia, but all swollen face and hands is. Okay, so this swelling done moved all up the body. What else, y'all?
Proteinuria.
Proteinuria. So we know your kidneys are starting to go down and deteriorate because you putting out protein. That is not allowed. What else? High blood pressure, right? This is your preeclampsia triad. Y'all all right with that? That's a triangle. Now wait a minute, because we need to remember there's a difference in the inside of the triangle and the outside of the triangle. The outside of the triangle has something called signs. That's what you assessed, saw, or picked up on. The inside of my triangle needs to have her symptoms. What's a symptom? The first one should always be headache, because you know the minute I wrote high blood pressure, you should have thought headache. Okay, then I heard something really good. I heard visual changes, and there's one more that you may not remember. What is it?
Tremors.
No. Abdominal pain. Because what body part is involved now? The liver. Very good. Now look at this. The outside of the triangle is the signs. The inside is the symptoms, what she told you. Okay? You can't see her visual changes. You can't see her headache. She has to tell you that. Y'all with me? Y'all all right? Okay. All right, so there you go, boo-boo kitty. Now, look at the bottom. I want to point out something because this is where they catch you every single time they get you in trouble. Do you see where it says headaches in pregnancy? Only see first when? I would highlight the fuck out of that if I were you. Because so many of y'all want to see the damn patient first, and they 12 weeks, or they 15 weeks, or they're 14 weeks. Why do you have to wait till after 20?
It's a full fetus.
But that's a good guess. She said you have to wait till after 20 weeks because it's a full fetus. And that was a good guess because that is a reason for some stuff, but this is different. Why do you need to wait till after 20 weeks to freak out about a headache?
The third trimester?
Yeah, because pre-eclampsia does not occur in the first trimester. It only occurs in the second and the third trimester. It is not considered a first trimester issue at all. What are most headaches in pregnancy related to in the first trimester?
Like the food that you stop eating.
Food.
Is it the hormonal changes with the...
You want to know the number one reason why women get headaches in the first trimester? It's because they decided to cut out their caffeine and they didn't need to. And they get a rebound caffeine headache from straight hell.
Those hurt.
And they hurt like hell. What I tell my patients is stop it. cut it out. Just drink your 1 cup a day. You'll be fine. Stop it. 1 cup of caffeine a day is nothing. But the problem is so many of you in this room live at Starbucks and you have at least 3 a day. If you got pregnant tomorrow and decided to cut that shit out, you would be dying. It is a severe from hell headache. Just so you know that. It is easily stopped with a cup of coffee. So I always tell my students, don't stop any of your bad habits until you take the test. Then you clean your life up because you can't afford to be sitting at the test with a headache. Okay? Just wait to stop your cocaine and your reefer smoking, all that shit y'all doing. Wait till after your test is over, honey. Get right with Jesus later, not right before a test. All right. Now, ignore. Look what it says. Ignore swollen legs in pregnancy. What does it say your weight gain in pregnancy should be? 25 to 35. Now, y'all be on some trash. Because I didn't see people gain that 25 in the first trimester, which is sick. So how much, I'm coming around, how much should they gain in the first trimester?
5 pounds.
What do you think? 3?
About 12.
12?
4. 7, 8.
One number, that's a big ass range. Yay! So up to 5, but not, doesn't have to be 5, it could be 2, but somewhere no more than 5. That's the biggest take-home message. No more than 5 in the whole first trimester. So remember, if you do 25 to 30 pounds and you only gain about 5, and not even, but that's your max, in the first trimester, then the second and the third is 15 pounds or 10 pounds or whatever each almost. You see that? You're supposed to gain all your weight in the second and third trimester, not in the first. And when you do, check yourself out for a C-section because that's usually what we see. It's very unhealthy. It's the worst you can do. Check yourself out for pre-eclampsia because that's what we see. Okay? It's really bad. Weight gain out of the norm in pregnancy is really bad. And if people would just make sure they didn't think they were eating for 2 when their baby is the size of a rice grain, they would be okay in that first trimester. Okay, so that's the deal. All right, so that 25 to 35 pounds, that's huge. It's on the paper, write it, highlight it. Oh, this one I love. What's the next line say?
Any regular pregnancy is abnormal.
Highlight the word any. I have one person after another saying stupid shit like, oh, well, they told me it was normal. I know they did because they're stupid. But bleeding is never normal in pregnancy. It must always be something we are asking about, concerned about, and we want to figure out why. Now, it's not that it can hurt you, it's just that it's never normal. Okay? It's not that it can hurt you, it's just that it's never normal. Things that make me feel better about your bleeding is if it's brown and it happened after intercourse. That makes me feel better because I know the pregnant body is so full of blood, it doesn't take much to get a nosebleed or a little bit of bleeding at the cervix, but it's never normal. Don't mistake common for normal. They're not the same thing. It can be common, but it's not normal. Does that help? So if I make sure my patients understand that, then I save their babies' lives. With the example of my patient who was 27 weeks, had just had intercourse and was spotting. I don't know if I should call you or not, but I know how you're going to cuss me out. You told me that the 10 warning signs said any bleeding. So I'm calling you. I said, okay, I'm so happy you did. Please come in. I don't like it. Because why? She's 27 weeks. She had not been calling me before, but today she did. So come on in. Now, the funny thing is I always tell my patients, I will see you when you get there because I always get there first. Well, I got there first. It's 4 a.m., 5 a.m. I'm calling. Where the fuck are you? And I mean, we're talking early morning. I'm sitting there at 4 a.m. It turns into 5 a.m. She's still not here. Now, I do get that women are crazy. I get that you want your hair on fleek, your nails done, your whole body done up real cute before you go to the hospital. But we've already waited an hour and you're still not here. And I'm calling and you're not answering. And I'm like freaking out a little bit of lightweight. Like, what the fuck happened to her? Well, somewhere right before 6 a.m., she comes off the elevator profusely bleeding like a faucet. It is running all over the elevator floor and pouring out of the elevator when the elevator opens, and it's now in the carpeted section of the unit. She's fully abrupting her 27-weeker out of her uterus. And again, if I had not stressed that no bleeding is normal, she too would have thought, it's not that big a deal after intercourse. Here she was, just bleeding profusely. And thank God, you know, we're at Rainbow Babies and Children at University Hospitals. Of course, that baby's going to be okay. The baby went to Rainbow and everything worked out, stayed there a while for weeks and went home with mom and dad. I mean, but again, you must understand that no bleeding is normal. Never. It may be common, but it's not normal. Okay? All right, then you see, remember, sciatica, back pain, mild shortness of breath, frequency in urination is very normal in pregnancy. Not normal in anybody else, but it's normal in pregnancy. That is sometimes very hard to understand because the pregnant body presents so very differently that if you don't understand this kind of stuff is actually pretty damn normal. You might flip out when you get that patient on your test who's short of breath at 37 weeks. You may not understand it's perfectly fine. You may not understand that in the first beginning of pregnancy, you pee a lot. It's not a bladder infection. You just pee a lot. You may not understand that at the last trimester of pregnancy, you just pee a lot. It's not a bladder infection. You just pee a lot. Sciatica, what is that? Where does that hurt at? Your lower back, your hip, and it radiates down your leg. Totally normal. And it's very painful. Yeah.
I wanted to ask you, is abdominal pain normal in pregnancy?
She asked a very good question. Is abdominal pain normal in pregnancy? I'll come around and you'll tell me what you think. Yes or no? So 50% chance of getting the shit right.
No.
No. No. Absolutely no. No.
Fluttering.
No.
No.
No, in fact, I tell my patients, and maybe we'll go over that now because you guys have good questions right now. It's a very good question because I tell my patients this list of warning signs to point out what's normal and what's not. And instead of saying abdominal pain, I literally say any pain. Any pain you're having, I want to know about because what the fuck is that? So let's look at some of those 10 warning signs. Some of you already know them. We just did one big one. What is a warning sign? Bleeding. Right? So any kind of bleeding. Any kind. I should make you write that. Any bleeding. And I have my patients, when they come for every single visit, I quiz them on all the 10. They got to give me their 10. They know their 10 real well by the time they're 9 months. Okay, so any bleeding. What's another one? You just had one earlier.
Blood pressure?
How the fuck would they know? Think about it.
Headache.
You're doing better. Remember, blood pressure is us. Headache is them. That's a big one, isn't it? Let them call you for any headache and let me decide if it's a big deal or not.
Swollen.
Swollen what, baby?
Hands.
Yes. See, you're doing good. Hands and face swelling. And you do have to say hands and face because they'll call you every minute of the day about them damn cankles. Okay, what's another one?
Baby not moving.
How would they know?
High fever.
Baby not moving.
What do we say?
No fetal movement.
What do we say? Because she said no fetal movement. Do I want it to go that far?
Oh, when it doesn't feel
Decrease.
Yeah.
Decreased fetal movement. I never say none because it's too late.
Yeah, you did.
I want you to tell me about any changes. Your baby got an attitude today? I want to know. Oh, they acting up today? Oh, tell me, honey. Because I want to save your child, and thank God I do that because I've saved many children before they died. The one had the cord around the neck 3 times. So she was right. She was absolutely right. What other warning sign?
Abdominal pain.
Any pain. Didn't I just tell you that? I didn't say abdominal. I said any pain. I want to know what hurts. Because, see, your abdomen is her pelvis. So she ain't going to call you. Your abdomen is her back. And her back is hurting because she's in preterm labor. So she ain't going to call you because you said abdomen. Your abdomen is her flank because her kidney stone came back in pregnancy, which happens all the time. Your abdomen is not hers because it hurts up here instead. This is her gallbladder. Any pain. I don't give a fuck where it is. Any pain, call me. Let me figure this shit out. What the fuck you pay me for? Okay. What else?
Blurred vision.
Yes. We say visual changes, right? Floaters. Don't get caught up on blurred. It could be floaters. That's a big one. Visual changes. The floaters, I think, is real close to being the most popular thing I see in pregnancy that tell you preeclampsia. Floaters. Just things floating, and it ain't really nothing floating. It's your eyes. Your eyes seeing stuff floating. That's like preeclampsia. Okay? Okay, what else y'all want?
Fever.
Oh, good job, baby. Fever. Very nice. What else y'all want?
Trauma. Accidents.
Yes. Falls, motor vehicle accidents, and trauma. So this is a good one. I think I want to park here and give you a good example because I want you to know this shit for the rest of your life. I have a delightful patient. She worked right here at Progressive Insurance on the corner. When you leave up out of here, that's the headquarters. She came out of Progressive Insurance. She came out and sat right at the red light. That's right by Progressive. Y'all know where it is. That red light before you get on the freeway. She ain't doing nothing but sitting there in her car, minding her business. And all of a sudden, she gets bumped in the back. When she got bumped in the back, it was by a construction truck. Now, she's sitting in her car. I want you to use your imagination. Where she's 37 weeks. No, she was 36 weeks, just started it. Where's her belly?
On the steering wheel.
On the steering wheel. When she got tapped in the back of her car, where did her stomach hit? The steering wheel. She called me with this hot mess. Hey, Shelly, I know you're going to cuss me out. That's the only reason I'm calling you. It's not a big deal. I had a little fender bender. They didn't even scratch my car up. We exchanged information. The baby's moving. I'm doing fine. I don't have no pain. I don't care about all that. Meet me at the hospital is what I told her. Are you serious? No, for real. Nothing's wrong. I promise you. I'm doing good. I'm going to try this one more damn again. Meet me at the hospital. I'll be there before you. I'm in university hospitals. She come to university hospitals. I do what I know I got to do whenever there's any of this, which is put her on that monitor for 4 straight hours. Her monitor looked beautiful, more beautiful than any baby in the neighborhood. I said, okay, I got one more thing I got to do before I let you out of jail. I drew her blood to see if there were any fetal cells in maternal blood. And there was. Her baby had abrupted just that easily. Because when you tapped that steering wheel, you tapped that placenta and it bled. So now you ain't going nowhere. We're about to have a birthday party. So now, can I induce her with Pitocin? No, not unless I want to kill it. She has to have a C-section. I delivered 2 children before this. She never needed a C-section. The only reason she's getting a C-section is because of this motor vehicle accident. Guess who will never work again? She's so filthy rich. Because remember what I said hit her. A big famous company I won't put on tape. But that motherfucker hit her and she will never have to work again. Now, why will she never have to work again? Number one, her body had to be cut for no other reason than this accident. That's money. Because you would have delivered vaginally and not have to recover for 8 fucking weeks. Number two, it made your baby come prematurely and they had to spend a day in the NICU. Because her children come at full term. I delivered 2 others. Number 3, pain and suffering from going through this shock that I just came out of work and now I'm in a fucking hospital having a baby. Okay? You get paid on that. Don't minimize none of these. All of these are huge. What did she say? You gonna cuss me out if I don't call you? Sure will. Because I quizzed your punk ass every visit. And you had to know these and you had to tell me them out of your mouth before I even listened to your baby's heart rate.
So the reason I asked the question was because it happened to me when I was pregnant with my last son.
This one?
I had a varicose syndrome.
Whoa. You had a what?
I had a car accident when I was pregnant with
okay.
her. But I used to get pain here, but I don't know if he was a PNP doctor, I can't remember right now. He didn't think nothing wrong with it. But I did give birth to my son prematurely.
Okay, so when you had the car accident, how far from his birth was that date?
I really can't remember right now, but I just know I kept complaining about that pain for a while. And then he was supposed to come August 26th, that was the due date. And on July 1st, coming out from work, I just felt like I was bleeding. And then I used to work in the hospital at the time, but I didn't want to be there, so I drove to my regular hospital and I gave birth to him, and I had to have a C-section.
Was it painful?
It was.
Like abruption, maybe?
Yeah.
And you don't know what it was? Just premature?
He can. I don't know, but I did have that.
Isn't that interesting? So, it could be a slow bleed, a slow abruption. It could be anything. Like my patient was very slowly bleeding. There were not many fetal cells.
But I didn't have the bleeding after the accident.
She had no bleeding.
Oh.
Remember what I said. She had nothing. Just because you're bleeding up here tiny amounts, which is evidenced by the fetal cells in maternal, you're not going to see it down here, ever.
Right.
So it's concealed because it's so small.
Oh.
Now, so trauma. My patient's significant other thought that it might be a good idea to stomp her with his Timberland boot in her chest. Another one of my patients called me, her horse kicked her in the chest, broke her ribs, fractured them. You could have anything. You just would not believe the trauma shit you see. Mostly domestic violence. I watched this happen one day. I was at the hospital where I was having, where I have OBGYN appointments. This particular hospital, the way my office was, I faced the window and I was in the waiting room arranging something, and that was right by the door and the window. And I happened to peer out the window and I see my patient, 9 months, running towards me, this where I am at the clinic, with breakneck speed. Now you need to think about that. Every step she takes that fast and that hard, boom, boom, boom. What's happening? Her belly is bouncing in a way that should never happen. And she literally abrupted. What was she running from? Her boyfriend with the gun. Yeah. Huron Road was off the chain. Okay, now, so you get it. trauma, motor vehicle accident, falls during this weather, all day long I'd get calls. And all damn day you coming in. You coming in, I'm finna put that monitor on you for 4 hours. I'm finna check your blood for fetal cells. If you pass my test, bye-bye. Okay? This is icy. This is crazy. These poor pregnant women, their balance is off. It's crazy.
For the diabetic, you want to?
No, because you should have known you was a diabetic before all this, right? These are warning signs.
Sugar is higher.
Because I give this to every patient. Every patient's not a diabetic. Okay, what's number 9?
No, I'm saying what 9 do you get?
It's not. Because every patient is not a diabetic and every patient ain't checking sugar. What's number 9? Leaking fluid. Very good. Leaking fluid. Maybe your water broke, maybe it didn't. Let me figure it out. That's what you pay me for. If it did and you're too early, boy, are you going to be glad you told me ahead of time. Because that's going to help your baby. Okay, what's number 10?
Nausea more than 24 hours.
Yes, vomiting, right? Vomiting or diarrhea, either one of those, for greater than 24 hours. The main one is usually vomiting. Because I don't really see too much diarrhea in pregnancy.
Does it matter in the trimester?
Why? No, it doesn't matter. Because if you can't keep nothing down for 24 hours, I need to know about that. Your ass need IV shit. So you might have hyperemesis gravidarum, and I need to really stabilize you. Or you might have a very common event in second trimester. You might have cholecystitis. Gallbladders are naughty in pregnancy. They're terrible. So you may have some cholecystitis. You're not keeping anything down. That would be about right. Okay? You may have a virus, a infectious virus that I need to give you an antibiotic for. I don't know, but bottom line is you getting dehydrated is not a good plan in pregnancy. You see how that goes? So you got 10, right? That's what I tell you to know, the 10. And this will help you on any test, because if you see anything like that, you're like, oh, wait a minute now. Shelly said that was serious. Okay? All right, now, so that's that.